Alright, okay. So we've been talking about congenital heart diseases. Now, in talking about these congenital heart diseases, we're just trying to give like some one or two overview on the types of treatments for them. You understand? So one modality of treatment is the artificial tube prosthesis. Okay, artificial tube prosthesis. Okay, so we'll get to define it. All right, so it's just a way of trying to keep the valve patent. Do you understand? Because normally you can have a lot of valve issues, blood vessel issues too. Okay, so artificial tube prosthesis just typically refers to what? A synthetic graft, or tubular implant. Okay, can you see this? It looks like a tube. They put it inside the blood vessel. So it could be valve issues in the heart or blood vessel issue. Okay, but mostly blood vessel issues though. So for this one, what we have is it helps to repair hollow structures in the body. That's mostly what blood vessels. So these processes are vital in vascular surgery and other medical procedures. Do you understand? Where like the natural tissues there can no longer hold like the vessel apart. Let me say there's an issue here and the blood vessel kind of like constrict. Okay, so you can use a prosthesis to kind of like keep it patent, keep it open. You understand? So common uses of the artificial tube prosthesis include vascular grafts. So they can use it to bypass or replace damaged arteries. So if an artery is too damaged, I can even put it to like bypass it. You understand? We're not here to teach about surgeries though. We're just here to like at least you guys will have an idea of it. You can see this one. There is like weakening of the artery there. Do you understand? So they can actually use the prosthesis there, okay, so that the function of that blood vessel is still on. Then we have urinary tract repairs. Tubular prosthesis may be used to reconstruct or support some parts of the urinary system. Okay. Then trachea and esophageal ones, rare cases. Okay, can be used there. But the ones we are mostly focusing on is the one for blood vessel, okay? Because that's the one I actually came across. So for the different type of materials they use for this, they can use Dacron. That's why I see there's a Dacron graft, okay? Can use Dacron materials. They can use expanded polytetrafluoroethylene, okay? Due to their durability and biocompatibility, they are very compatible tissues, okay? Then tube shape. Alright, so they are designed to mimic the natural diameter of blood vessels mostly. Then porosity. So they are porous to allow tissue integration, while others are sealed to prevent leakage. Okay, so that is just what if they tell you that an artificial tube prosthesis, this is just what they mean by it.